This program is brought to you by Emory University.
And it is wonderfully appropriate today that we welcome Mrs. Rosalynn Carter to speak with us. Almost all of you know, of course, that she was the founding partner, along with her husband, President Jimmy Carter, of the Carter Center with a mission to wage peace and cure disease and build hope. It is within that, underneath that umbrella, that Mrs. Carter has been especially focused on mental health and wellness. I'm going to put my glasses on because I want to read of her accomplishments, because it's been more than 35 years that she has been one of the world's foremost and longest-standing advocates for people with mental illness. She began addressing mental health issues as the First Lady of Georgia back in the 1970s, a time when few would even discuss it openly. And then she continued in the White House. Mrs. Carter continued her dedication to reducing stigma against these disorders, serving as an active honorary chair of the President's Commission on Mental Health, which resulted at that time in the passage of the Mental Health Systems Act of 1980. But that was only the beginning, because this commission also recommended parity for insurance coverage, which finally was realized and achieved in the fall of 2008. Today, Mrs. Carter remains and retains an active leadership role in mental health through her work at the Carter Center. And she is, and she brings to all of this an academic background, a graduate of Georgia Southwestern University, president of the board of directors of the university's Rosalynn Carter Institute for Caregiving, which promotes mental health and well-being in individuals, in families, and professional caregivers. And for us, she is currently a distinguished fellow here at Emory of our University Department of Women's Studies in Atlanta. Will you please welcome to the podium and the lectern, Mrs. Rosalynn Carter.
Thank you, Jim, for that introduction, and thank Paula. And I am really pleased to be here. It is so exciting to me that you're having programs on mental health for a whole month. I mean, that is unusual in a university, and it's really exciting to me. I want to thank the Emory Healthcare Faculty and Staff Assistance Program. And also the task force is so important here at Emory, and I'm glad the mental health program is working with you on that. Because this is age when students are students, when so many serious mental illnesses develop. And it's so good to have support on campus. And I just am really, really pleased to be here. And it's so important to help people understand mental illnesses. And I think that when people understand mental illnesses, the stigma will dissipate. I've been thinking that for a long time. It hadn't dissipated a lot lately. But I do think it helps. And because stigma is the greatest barrier to getting people with, to help people with mental illness, to getting help for people with mental illness. It perpetuates the myths and misconceptions. It curtails attention from elected officials. It's hard to get elected officials to work on mental health issues. They think it's going to cost too much to do anything about, just like insurance companies. And it's hard to get funding for mental health programs. We experience that all the time. It humiliates those who are living with the disease, and it is so wrong. The tragedy is that it keeps people from getting help. They don't want to go to a mental health professional because they'll be labeled mentally ill. And what so many people don't know today is that mental illnesses can be diagnosed. We have learned so much in the last decade or two. Mental illnesses can be diagnosed, they can be treated effectively, and the overwhelming majority can lead normal lives, living at home, working, going to school. And it's just a tragedy when people suffer and don't get help. We have a great mental health program at the Carter Center, and our staff has really enjoyed working with Emory on both the task force and the Step Up program. And I don't know, maybe most of you here know that Emory University and the Carter Center are partners. Jimmy says we have a marriage. And we do work closely. In fact, I have a liaison with Emory to my mental health, on my mental health task force. Nadine Caslow is on the mental health task force, and the task force guides what my mental health program, what our mental health program does. And as Jim says, I have been working on mental health issues for a very long time. And when I tell you the situation when I started, you will think that was ancient days, and it was. In 1959, well, I don't go quite that far back. There was an expose of our big mental institution, Central State Hospital in Milledgeville, Georgia. People were packed into the institution with very few services. The staff struggled just to try to get them something to eat every day. Back then, you'll realize we didn't know anything about the brain, very, very few treatments. And so most people were just put out of sight, so many warehoused. And at that time, when I got involved in 1966, the people were being moved out of the institution. But this was going on all over the country in that time. And in 1963, the Community Mental Health Centers Act was passed, and that was supposed to move people out of the institutions into community centers. And there was supposed to be a community center built for every person, within reach of every person in our country who needed help. And we just thought that was great. But back then I was not very involved in mental health. I was not involved in mental health at all. But I still knew about it and thought it was so great that we're going to be able to get rid of this big institution, because I had been there. I had not seen a lot because it didn't show you very much when you went. But Jimmy had a cousin who was there, and we had been there maybe on 2 occasions, just stopping by to see him. And of course, you're meeting in a reception room or something. We even went to a dance one night, and Jim and I mean, they got up to dance and at this meeting, and so Jim and I got up and danced, and they all stopped dancing and snickering, and we finally found out that we weren't supposed to be dancing close together. But unfortunately, deinstitutionalization didn't work as it was supposed to be. And I learned that when I began campaigning. That's when I first got involved with mental health issues. When Jimmy ran for governor in 1966, and that's a long story because he was running for the legislature, he was in the Senate, and at the last minute, our leading candidate dropped out with a heart attack, leaving Lester Maddox as our Democratic candidate. And he was a big segregationist, and Jimmy came to Atlanta to see who was going to run against him, and nobody was. And he was very popular. And I remember walking from our office, I was working in an office, home, which is a half a mile, and Jimmy's mother lived halfway between. And I was walking by her house, and she called and said, "Jimmy's on the telephone." So I went in, and Jimmy said, "Are you sitting down?" And I said, "No." He said, "I'm going to run for governor." We only had a few weeks to campaign. But I got in the car, never done this, but I set up with one of my sons, and we would go to a community, shake hands with everybody, pass out brochures, get in the car, and then knock on the door of the newspaper office, the radio station, the television set, and say, "I'm here, interview me." And then we would drive to the next community. And everywhere I went, without exception, somebody asked me what my husband would do for the mentally ill person who was being moved out of Central State Hospital. And I met people crying. Loved ones were coming home, and they didn't know what they were going to do with them because there were no services available. And one day I was in Atlanta. I'd been campaigning for several weeks. If you can believe it, I was at a cotton mill at 4:30 in the morning, meeting the shift change, giving brochures to people coming off work and people coming to work. And this woman came out from work. She'd been working all night long. She had on a navy blue sweater, and her hair and clothes were covered with lint. And I asked if she was going home to get some rest. I said, I hope you're going home, be able to rest. And she said, well, I'm going home, but I don't know whether I'll be able to rest or not. She said, we have a mentally ill daughter. And the reason I work at night is because my husband's salary does not pay for her care. We both have to work so that we can get care for her that we need. He stays with them at night while I work, and I stay with him at day while he works. Well, after hearing so much all the time anyway, it made a really, really impression on me. And that night I was campaigning in Swainsboro, Georgia. And it was a mixed-up campaign. We just got in the car and drove, but I learned that Jimmy was coming to the same town that night. So I stayed and got in the back of the room, and he didn't know I was there. And he had a big crowd, so I just got in line, and I went down with everybody else. And when he got to me, and when I got to him, I don't know about you, but I stand in receiving lines all the time, and sometimes you're just holding, when you reach for the next hand, you're still talking to the person in front of you. Well, Jimmy was doing that, so I reached for his hand, and he was talking, and he turned around and said, "What are you doing here?" I said, I want to know what you're going to do when you're governor for people with mental illnesses. He said, we're going to have the best program in the country, and I'm going to put you in charge of it. Well, somebody heard that, and the next day it was in the paper. And all of the advocates in Atlanta descended on me. All 5 of them. Now, at that time, nobody wanted to be associated with mental illnesses. Nobody wanted to admit if they had a family member. Nobody wanted to talk about it. And it was, and as soon as Jimmy was elected, as soon as that year he lost. We campaigned 4 more years. And then he won, became governor. And it was hard because, well, he set up the Governor's Commission to improve services to mentally and emotionally handicapped, and I served on that. Of course, he didn't put me in charge of it. I knew nothing about it at the time. But I was a member of that, and my job was to tour the hospitals in the state and report back to the commission, not to criticize them, but just to go fact-finding, just to see what was happening and what was needed, which I did. And it was hard for me, and it was emotional to see so many people suffering, because there was almost nothing back then, no help that were getting when they've been in the hospitals. And it was hard anyway, because I would call a meeting and the only people who would come were my 5 advocates, maybe a few government employees because Jimmy was governor. But we set up a separate department of mental health and got a really good person to lead it. And the only thing I could do back then was just talk about the issue, try to bring it out into the public, getting people to talk about it. Well, it was not easy. But it was challenging, and I became so concerned about what people with mental illnesses went through and what they needed. And that was the beginning of my education about mental health issues. And the more I saw, the more concerned I became. And I did have a President's Commission. We worked for 4 years very hard. We got the Mental Health Systems Act passed, as Jim said. And in September of 1980, in November of 1980, Jimmy lost the election, and my mental health program was gone. We had gotten it passed and funded. It was never implemented. It was the biggest disappointment I think I have ever had. And think about, we had great programs and had the money for it too, which is, most of the time Jimmy did something, he had the money for it. And now we have a great program at the Carter Center. We work on stigma, trying to overcome stigma, and on trying to influence policy issues, policies that affect people with mental illnesses, trying to make life better for those with these illnesses. We have an annual symposium on mental health policy. And we're really fortunate now because we get the experts from all over the country to come. In any subject we work on, we have the experts there, we have the government officials, we have the top leaders in the country. And what we try to do, we take current issues and we try to focus and come to some consensus about what we could possibly do, all the different organizations, so that maybe we can make a little progress. Nothing is easy, and nothing is quick in happening in the mental health field. And this year, for the first time, we're working with local advocates trying to do something about the shameful Georgia mental health system. And that's been, I think you all know, 136. In fact, there have been more. I was told the other day that 2 more had committed suicide, had died in the mental health hospitals from neglect, from patient neglect, which is tragic. But there was a big expose by the AJC, and we're working now with trying to, with the advocates, and it's been a really good experience for us. And we've reached out to people outside the mental health group. For instance, I spoke to the Atlanta Pastors Association to get the religious community together. I think some from the mental health program spoke to the Sheriff's Association and others. So we've reached out to try to get a larger group to advocate for better health services. Well, we have on stigma, we work continuously to educate people, to let them know what we know about the issues, to let them know that the overwhelming majority of people don't have to suffer. Treatments are available. There should be no stigma. From what we know now, there should be no difference in illnesses. No matter all of biological, all of your body, and there should be no shame and no discrimination. The end result of stigma is discrimination. And people with mental illness have to worry about housing, getting a job, education, insurance, even by mental health professionals sometimes. But we have many initiatives, and one of the best ones I think that we've had are mental health fellowships for journalists. We were sitting around one day trying to think of what else we could do to try to overcome stigma. And somebody said, why don't we get in touch with the media? They have such an influence that actually form what people think about mental illnesses. What they think about mental illnesses and what they think about people with mental illnesses. And so we decided to bring journalists to the Carter Center, and we do have training sessions for them. We bring them there, but we want them to know how to report accurately and hopefully stop all of those sensational stories. Instead of writing sensationally about something that happens, because so many people don't know why somebody commits an act, a violent act. And if they look into the background and find out why that person did something and report accurately on it, it'd just be so helpful, because you can work and work and work on stigma, and then some big sensational headline comes along and destroys everything you've been trying to do. Well, this was our 13th year, and we had our mental health journalists at the Carter Center this week. It's one of my favorite times at the center, because they come, and also it's a significant year because we now have had over 100 journalists go through our program. We have 6 from the United States. I'm trying to look to be sure I know where the others are from. Because I was at a meeting the other night and I started saying we said 6 from the United States, 2 from South Africa, and I could not think of where the other, and they were in the audience, 2 from Romania, and 2 from Romania. And as I said, we have but another thing that's so important, that was so exciting to me, is that we have been from the very first day, for very first year of this program, we have gotten the best people. The status of those who apply for these fellowships is really incredible. And this week we had one from the Wall Street Journal, one from NPR. We had a New York Times reporter there as our speaker, and we had one from the LA Times, We had some others too, but I mean, we just have the best people. We've had 60 Minutes and NBC. We just have, I mean, it's so great to have them come. Washington Post, we have, and what's so good is that once they come and learn what's going on and how much they can help, they don't work on this program just 1 year. Almost invariably, they stick with it and write mental issues about mental health programs. And we don't tell them what to write. We hope that they will write good stories, but we don't tell them. They apply with a subject, they work on that subject, but then when they go back and are working on other things, I mean, after the fellowship is finished, and they still write stories, almost invariably they do programs about people who have had mental illnesses and now maybe the CEO of a company that have really good jobs and really doing well and holding really good positions in life. We have a training session to let them know what's going on. One thing that is important is language. When people write about she's a mentally ill person, he was a mentally ill person, that is hurtful to people. You don't say he's a mentally ill person or she's a mental. You say she's a person with mental illness. It's a person. You don't say he's a cancer person or he's a heart disease person. They don't want to. They don't. It's not good. People don't like to be defined by their illness, and so people with mental illness. Well, you won't be surprised to say what I've almost already said. In terms of hard news, people who are acutely ill, psychotic, and violent are more interesting and sensational subjects for stories than those who live with a mental illness and are good, hard-working, productive members of the community. And the media just perpetuates stigma. We had a pollster at our meeting this year talking to the journalists. We have the ones that have come back from India, the outgoing ones, to tell us what they've done, and incoming ones to tell us what they're going to do. And we had a pollster there, and we was talking about stigma, and she said more people are willing to go to a mental health professional now than ever before, which is good news. And this stigma is beginning to lift a little bit, we think, for the first time since I've been working on mental health issues. And that is 38 years, if you can believe it. And another thing that's so exciting to me is the young people who are leading the way. The young people don't mind going. So many of them will go to a mental health professional, and it's just great. But the other thing she said was that more people than before, than in the past, associate mental violence with mental illness. And that was really difficult. I mean, it's so hard. So we worked so long to try to overcome stigma and let people know that is wrong. It's so wrong because people with mental illnesses are more often the victims of violence than they are the perpetrators and the perpetrators. And it's so, because we read about the big sensational stories, and it makes you think that everybody, and we've had some really sensational stories lately. Well, too many of the problems that I've been working on for more than 38 years either have not improved or have improved very little. And as Jim said, parity in insurance, equal insurance coverage for mental illness, equal to that of other illnesses. That was one of the recommendations of the President's Commission on Mental Health, our commission in 1978. And we finally got it passed in the bailout bill. If you can believe it, I was at a banquet in Washington and somebody came running over and said, Chris Dodd is on the floor of the Senate putting the parity bill in the bailout bill. And it was just before they voted on it, just very close to the time that it was brought to the floor, and it passed. So don't knock the bailout bill. It doesn't work. It doesn't work for economics. It's already done one good thing. And I have always thought that if insurance covered mental illness, it would be all right to have them. I really believe that's true. It legitimizes the illness. And so I got a lot of hopes for what's going to happen with the bailout bill. But it's a great step forward, but it only covers insurance for employers who have more than 50 employees. So we have a big step, a big way to go still. Another thing I wanted to talk about is children, because one of the things that I've been working so hard on is mental health in children. We know in the mental health field that if babies have good nurture, good health care, prenatal and postnatal, good nurturing, good mind stimulation, they have such a good chance to grow up to be well-adjusted young people. We don't care for our children in our country like we ought to. We wait until they get into trouble to work with them. Just think what would happen if we could screen, if all our young children had good care, if we could screen them for problems. Because now what we've learned is, for so long we didn't think children had mental illness. But now we know that if they start very, very early, mental illness is doing it. We could catch those. The earlier you can catch them, we could catch so many of them and prevent so much suffering if we just had the political will to do what we need to do for children. And there are some things that give me hope, though, and everything that doesn't give me hope. And I've already talked about the parity in insurance. But the greatest thing that has happened in all the time I've been working in mental health is that now we know that people can recover from mental illnesses. Recovery is something that was never dreamed of when I began working in the field. We have one good example of here sitting right over here. And so, a person I love. But now we're even talking about prevention, and I really do think so many mental illnesses can be prevented if we screen young people and caught mental illnesses when they were in the early stages. Many of them could be prevented. I'm just really I'm sure that could happen, because the earlier you get it, the less problem somebody will have with it in later life. Well, what can people in the Emory community do to reduce stigma and the resulting discrimination? I think first, help get out the facts about mental illnesses. The programs that you're having like this one is so great. And I think that all of you here probably know that you can get that information from the Step Up program, and you can also get it from the Step Up website. But you can also look at the Carter Center Mental Health website, because we have a lot of information, not particularly how to overcome overcome stigma, but how we're working on it and what we're doing. And we also have archived all of our fellows' programs, everything that they've done, their articles and their TV programs and those kinds of things on the mental health website. If you know somebody who's suffering from depression, and I am sure there are many on this campus, 1 in 4 people will experience a mental illness every year, and there are people on this campus who are suffering. Let that person know that help is available. And also, if you have a friend or know somebody who is suffering from depression, if they don't feel good, they're crying a lot, if they're not able to study, don't want to study, feeling sad and unhappy all the time, sleeping too much or not being able to sleep, if they have those symptoms and it goes on for more than 2 weeks, if it's somebody close to you and it goes on for more than 2 weeks, be sure that person gets professional help. And that professional help is available here on this campus. But be sure they get help, because you get it early, you can do something about it. And what the posters tell us is one of the best ways to reduce stigma is to have a first-person contact with somebody with mental illness. She said that it was not this time, but one of our last meetings. She says, if you learn that your neighbor who's your friend suffers from depression, for instance, or the person in your office, then you're not afraid of that person. You know them, you like them, you're not afraid of them. And she said one interesting thing was that the polls show that an overwhelming majority of people say they would not work with a person with depression or mental illness. She said they're probably sitting by one in the office right now and don't know it. And that's like saying 49% of Americans, no, it's just a recent poll that said 49% of Americans saying, don't let the government take over my Medicare. Another thing you can do for those with is advocate for those with mental illnesses and addiction problems, because those are brain disorders. They're diseases. They're not just something somebody can just get over. And get to know the groups that are involved and help them. And their programs at the task force right here on campus. There are lots of students. I know you can help with that. And right now, the Carter Center is working to improve the mental health system in our state. And I told you we've developed advocates. You could be advocates to get quality care and help get quality care in our state. There are going to be so many remarkable advances in the future. Increasingly accurate diagnoses, improvements in treatments. One of the best things that happened is the consumer movement. Those who have mental illnesses, they are now kind of folding in people with mental illnesses and helping them and showing them and showing respect for them and letting them know that they're there to help them. And it's so many people are recovering, and it comes from the consumers. They started that. In fact, I talked to Tom Insel at NIMH not long ago. I'm writing a book. I'm writing a second book about mental health, and I got it off to the copy editor on Monday, so I'm going to have a lot of time. But he's really discouraged because at NIMH they've been working on medications, and what they've found is they're not working nearly as well as they thought they would. They've helped so many people, but there's so many more that they have not helped. And what is happening on the ground in our country is really incredible. We have a peer support program in Georgia that Larry Fritz, who is a consumer, developed, and they asked him to run the consumer office, and now he's able to get Medicaid for mental health, for the peer support program, to train peers, certified peer specialists in the state. We have over 500 of them in the state, and they're going through the state looking for people that are homeless and suffering from mental illnesses, to just gather them in and show them that they can be well-respected citizens.
You've heard the name Jerome Lawrence. You've actually met the man, Jerome Lawrence, who has been our featured artist, and she says a hero. We want to thank Rosalynn, Mrs. Carter. We want to thank you. I'm sorry for your participation here today by giving you a framed piece of this artwork. Jerome is, I'm told, an outspoken advocate for mental wellness, and gives testimony to his own journey with schizophrenia, as I understand it. And so this artwork is all the more precious to us, and we hope to you. Thank you so much for participating today. Yeah.
And Jerome is here with his wife, and Habitat for Humanity built him the first house that they built for a person with a chronic illness. So I'm really proud of Jerome.
The preceding program is copyrighted by Emory University.